Hello, fans of the Diabetes Treatment channel. Today we have a very interesting topic to discuss. Lately we've been getting a lot of questions about this. So if you have this question, just watch this video for the answer. In diabetes, constipation is very common. And here, this is a summary drawn from 145 articles published in 2016. If you have diabetes, how should you treat it? How can it be managed at home? How do we treat it at home? We will study the article about this. And we'll go over the specific medications for the first step, second step, and third step. We will study this. So the first step is always to bring blood sugar levels back to normal and to start exercising. If a person with constipation has high blood sugar, they urinate frequently. Because of frequent urination, the water from the stool mass is also absorbed, and that too is urinated out. That's why it's important to normalize blood sugar levels. You need to lower it. That's the first thing. Secondly, the intestines. This is called peristalsis. The intestines themselves evacuate the stool mass. In order to expel it, for the food mass to move and be pushed along, they need to move. Movement slows down when sitting or lying down. When walking, they become more active. So after patients start walking, as we say in the morning, we recommend walking for an hour in the morning and an hour in the evening. Even after walking, it still works. Water. People ask if it's okay to drink water while walking. Yes, you can drink water while walking. For example, in the morning, they say, I drink water when I wake up. That's fine. Drinking water is allowed. For example, by drinking small amounts, 200 to 400 grams, several times within an hour or two. Drinking water in portions like this increases the activity of the intestines. It enhances peristalsis and leads to the evacuation of stool masses. So when we drink water, if our blood sugar levels are sufficiently balanced, we can effectively lower it and continue moving forward with our daily activities. So these are important things that are not directly related to any kind of medication. These were indeed matters entirely unrelated to pharmaceutical drugs. Next, we start consuming foods that add bulk and increase the volume of stool masses. These include greens and vegetables that contain fiber. Some people eat beetroot, others eat radish. They eat them. We consume tomatoes, cucumbers, cabbage from the greens. Now, the first of the supplements we take is psyllium. With psyllium, we've included the recipe for psyllium bread, 2 types of bread. That is this bread. If you eat it, now we move on to the recipes channel. Psyllium bread, we'll find it, and I'll continue telling you more about psyllium. What is psyllium and where can you find it? Here's the name, psyllium. Here is one. There's only one recipe. It seemed like there were 2, but there might be another one. So by adding psyllium bread, what exactly is psyllium? Here, I've prepared it for you. Here. This is the remarkable plantain plant, specifically known as barjizab in the beautiful Uzbek language. Here you can clearly see the plantain itself. You can readily find this beneficial plant at most pharmacies, where they often sell the plantain itself, including its carefully dried leaves and its equally dried stems. It's called psyllium. Psyllium is its husk, and you can add it to bread, or you can also consume it as it is. Many people frequently ask where to find it. Look, here are various dietary supplements, and here is psyllium in its readily available supplement form, which is quite common. It's sold, just like they sell chia seeds in these kinds of containers. Plantain and psyllium are sold at pharmacies. In places where supplements are sold, there are stores where you can buy vitamins, you can buy youthful hormones, and they are available at pharmacies as well. This is the dried stem of the plantain plant. That's where we start. To consume it, you can add it to bread. You can also consume it on its own, if you like. And bran. Look, pharmacies sell bran. From that, in addition, there is also wheat bran at the mill. After sifting the remaining bran, or this, bran is also sold at feed stores. The simplest, the cheapest kind is available. If you want, get it from the pharmacy. It's called otrub in Russian, wheat otrub. Look at this. This is pressed slim wheat otrub. It's called otrubi. Or here, this is just pure wheat bran. Only it's been packaged. To prevent constipation and vitamin deficiency, I recommend adding a couple of spoons or maybe even a cup of wheat bran to our oatmeal bread or other breads. Now this wheat, if you want to consume wheat bran to relieve constipation, take 1 or 2 tablespoons, dissolve them in water and drink. Or you can add it to your food or your bread. So the treatment is to lower blood sugar, do physical exercise, drink enough fluids, and take psyllium or take bran. Psyllium, like bran, is consumed for the same purpose, to increase the bulk of stool, to increase its mass and volume. There are people, for example, who eat only meat or a little bit of dairy, or for example, eat a little egg, and since there's no fiber, they get constipated. As a result, their stool doesn't move through the intestines because there's no fiber. So for now, psyllium and bran are commonly used to effectively increase the overall stool bulk. If this particular approach doesn't provide the desired relief, and if that specific method doesn't help either, then by significantly increasing the water content within the intestines, this can often lead to improved bowel movements and greater comfort. It helps with the evacuation of stool mass in the intestines. They take medications that increase this effect. These are lactulose preparations. You all know lactulose preparations. You've taken Dufalac. Here, Dufalac, as you may already know, you have probably taken it. We will typically start with 5 millimeters. If the things we've mentioned above are diet, exercise, lowering blood sugar, drinking enough fluids, taking bran or psyllium, and still our bowels aren't softened. In addition to that, if food's rich in fiber, don't eat too much cabbage or carrots, but in small amounts, it's allowed. Among food products, tomatoes and cucumbers, if the fiber in greens or turnips isn't enough, and what you've taken in, if your psyllium and wheat bran don't help, then lactulose preparations are used. People often say, but it undeniably contains sugar. Let's just pause here for a moment. Look, even if you were to take a full 10 grams, only a mere 1 gram, there might be 1 gram of sugar in it, which is very little, 1 gram per 10 grams. If you take this, they say start with 5 milliliters. Okay, let's say you take 20 grams. In 20 or 25 grams of Dufalac, there will be 2 grams of sugar. It's not dangerous. This means lactulose contains galactose sugar. It contains both galactose and fructose. The actual sugar here is only 1 gram, or it could be even less, if you take 10 grams. So lactulose preparations can be pure lactulose, or it can be Dufalac. It could be, there are many different brands available. And whichever one you ultimately take, it truly doesn't matter. Everyone certainly knows Dufalac. So let's begin with Dufalac. If these initial things don't help, we will then move on to the next stage. The subsequent stage is bisacaudal, which specifically means it acts on the intestinal mucosa and forms mucus around the stool masses by increasing its production, irritate the intestines and cause bowel movements. One of these drugs is bisacaudal. The Sano preparations, those Sano teas, Sano itself, and the various types of bisacaudal are all commonly used. In addition to these, in this particular group of medications, there is also sodium picosulfate or picosulfate sodium, which also exists and is frequently utilized. These specific drugs, when they ultimately reach the large intestine, begin to exert their intended effects. When they reach the intestine, these medicines produce a substance called diphenol, is formed. Phenol, the mucous membrane, irritates the intestines, the mucous membrane of the large intestine, and that mucus produced increases its production and helps the evacuation of those fecal masses, leading to their evacuation. Sodium picosulfate, Gutalax, Picolax, everyone knows Picolax. And now you can find it in drop form, from 10 to 15 drops. If you're worried, start with 5 drops, or it can be in tablet form. Gutalax or Picolax are widely available in our pharmacies. So if it's in tablet form, take 1 tablet once a day. If it's in drops, take 10, 15 drops up to 25 or 30, meaning that once a day, this will be enough for you to have a bowel movement, to go to the toilet once a day. You'll need to gradually find the right number of drops for yourself. Start with 10, 15 drops. You start with 10 to 15 drops. Only take it once a day. Don't take it repeatedly just because you haven't had a bowel movement yet. Don't keep taking it over and over thinking you haven't gone yet. The medicine won't take effect until it reaches the large intestine. It won't work until it gets there. So if these things don't help, friends, dear viewers, fans, everyone, you know, people truly care deeply about you, and they often imagine with a great deal of empathy that this particular person is struggling significantly, perhaps even suffering from chronic constipation, which can be a very difficult and uncomfortable condition to endure. For example, right now we need to prescribe treatment online. After a while, consultations will start, or maybe someone on Telegram hasn't received a reply to their message. You see, we care about you. It's not hard for me to make this video when I see you, to share this knowledge with you. It's not difficult for me to make these videos for you, thinking about you, not at all. It's really not hard. But if none of this helps, then you'll have to go to the doctor. You go to the doctor after all this, you've tried everything. That means there's something else going on here, or maybe you need even stronger medication. So you go to the doctor. If these things don't help, remember all of this. It's a 10-minute video. It's already 11 minutes. 11 minutes have passed. Let me repeat. To lower blood sugar, we lower it. We drink enough fluids and walk. We eat foods rich in fiber. The indigestible part of those foods, the fibrous part, is what, first of all, benefits the good bacteria in your gut. And secondly, it forms the bulk of your stool. This is mostly found in vegetables. Whether it's turnip, cabbage, or eggplant, all these are perfectly fine. You just don't consume things that raise your blood sugar. So we eat foods rich in fiber. If foods rich in fiber themselves don't help, we take fiber supplements directly. This is psyllium, meaning bargizab. Some call it oklok, some call it bargizab. Bargizab is the psyllium from plantain. Don't eat the whole thing. Use the purified bran part. Besides bargizab, we can also consume regular wheat bran. We can dissolve it in water and drink it, or add it to our bread and consume it that way. If these things don't help, we take lactulose medications such as Dufalac. Dufalac won't raise your blood sugar. In 20 grams of Dufalac, there is less than 2 grams of sugar. It's real sugar because galactose and fructose are different substances. They only reach your large intestine. They are digested and don't have time to raise your blood sugar. If you are constipated, your blood sugar may actually rise even more because of that. If lactulose medications don't help, then bisacodyl, which stimulates the large intestine, or sodium picosulfate products, or you can take Picolax or Gotalax. All of these products are taken once a day. Do not take them repeatedly. Preparing for surgery or removing toxic substances, these are different situations where they might be taken several times a day, but for you, just take them once a day. If it's drops, if it's a liquid, for example, if it's Difal, take 5 ml. If it's drops, start with 10-15 drops. And if that doesn't help, you can increase the dose once a day. But the rest is the gastroenterologist's job. The main thing for today that I wanted to convey to you is this. That's it. Now, let's answer a few questions. How can I join the channel? For new subscribers, there is only one way to join our channel, the Diabetes Treatment channel. Just send a message to the number 97-434-3536 on Telegram. You just write, I want to join the channel, or please add me to your school and send me a diet plan. That's how you join. For example, here, Otabek aka and Dilfus Opa did the same. Someone wrote, please send me a diet plan. Just message me on Telegram at 97-434-3536 on Telegram. How can I join? I am in Kyrgyzstan. They say, I can't join. You just need to message on Telegram and find a way to join. There's a way for everything. There's even a way to send a message on Telegram, isn't there? Someone asked, what medicine can I take to increase testosterone? To increase testosterone, you need to get tested. If the test shows it's low, then you can take something to raise it. Will it be enough, or do you need to get injections? That will become clear. It depends on the hormones. It depends on what comes up. There's no such thing as take this and your testosterone will go up. If there were, then no man in the world would have any problems with testosterone. I think that if 90% of men over 30-40 in this world had problems with testosterone, it would be necessary. So, I turned 54. But such energetic doctors I haven't seen. They say thank you. As I mentioned earlier, I worry about you. In Russian, it's called perjivat. They say kiladi. I always think about it. Oh God, please bring some kind of new development. For them, let there be some relief. Let's do some good. Let something new come out. Let them recover. Let more people recover. That's what we keep thinking. If you keep thinking about it, it will come, they say. So today this video came up as well. Based on your questions, we made this kind of video. I think it will be useful for many people. Thank you, they said. May God be pleased. So, they said, train a student worthy of yourself. Train a student from yourself, they said. May you always have a good and diligent student. I am officially registered as having type 2 diabetes. My left leg is completely numb and I have absolutely no sensation in it at all. Nesi tasakansesom. Is there any treatment for this at home? No, in this case, not even at home, even in the hospital, it might not be possible to treat it. Only one doctor can treat diabetic polyneuropathy. It can't be treated by just one doctor, it takes at least 2 doctors. An endocrinologist and a neurologist. You need to go through examinations, lower your blood sugar, and then you will receive neurological treatment. So they prayed for them. We won't read these, we won't say anything, we won't waste our time. Is it okay for diabetics to get a foot massage when their feet hurt? Yes, it's okay. Is it okay to drink kumis? Yes, it's okay. If fruits aren't allowed, we lose our appetite, don't we? This problem really bothers me, they said. Dilfuza Pardayeva. Dilfuza Pardayeva. For you, I will explain everything step by step. I've come out to explain. Fruits are not allowed. They raise your blood sugar. If your blood sugar goes up, it also harms your brain. Your memory will get worse. At the very least, it will also damage your eyes. Your vision will become blurry. It also affects the kidneys. It causes harm. It also harms your feet. It also harms your heart. The harm is a lot. So someone said, it's been 5 years since I was diagnosed with diabetes. Dilfuza. Parayeva. I used to weigh 98 kilos. Now I've dropped to 76. My blood sugar levels reach 13 to 14, sometimes even 17. Can I be treated? If you can control your cravings for fruit and make an effort, you can try. What kind of fruit is avocado? I've never even seen one in my life, they said. Tomato. If you search for avocado, even Google will show it. They have it in supermarkets. Tomato, is it allowed? How much can you eat? If you eat 1 or 2 in moderation, it's fine. There should be moderation in everything. The fasting blood sugar was 15. They took half a dose of the sports diet pill twice a day and it dropped to 6.5. They asked, is this good? Should I stop taking the medicine and get tested? No. If it drops to 5.5, then reduce it further by taking a quarter dose. Then reduce it to once a day. Don't stop all at once. You shouldn't stop suddenly. You don't need to take vitamin D all the time. Either take vitamin D or go to the beach every day for an hour in the early morning when the sun rises or in the evening when the sun sets. And get some sun exposure. That is, you get enough sunlight with most of your body exposed without clothes. Umid, it says coffee written on it. That's how it's written. If you see it, you'll be surprised. Or if you stand directly under the sun when it's just rising or when it's setting, you walk around for 3 hours with most of your body exposed, or you take it for life. It's your choice. Which one will you choose? If you sunbathe, you lie down and sunbathe. If you sunbathe lying down, it's 1 hour. If you sunbathe standing, it's 3 hours. Or take vitamin D. Should I take just Masteron? They said it's a 10-gram dose. Masteron is combined with Amnadren. You mentioned Androgel. You're going. They asked, where can you find Udorin? From the pharmacy onwards. It's all thanks. It's been almost 20 minutes. Let's find one really nice and interesting question, and then we can proceed to answer it thoroughly and completely. And then we'll wrap up. Where is the clinic located? Okay, it's at 21 Navoy Street. Look, here it is, Tashkent City, Sheikhantohur District, 21 Navoy Street. Here, on the left side at the very bottom. What's on my left might be on your right, or it might also be on your left. This is the clinic's telegram. It's not for calling, just write to this address. The 2 numbers above are for calling, for example, from 9 in the morning until late in the evening. You can call and talk during that time. After that, there's no point in calling. So, someone asked if we can drink this new Feta Diabet tea. You're quite behind the times. You must be one of the newcomers. This is useless. If you want to drink it, just have it as regular tea. But don't drink it thinking it will cure your blood sugar. As a tea, just like regular green tea or black tea, if you don't drink those and prefer this one, then drink it as tea, just to quench your thirst. But for your diabetes, it won't cure it. It won't fix it. Inshallah, see you tomorrow. Stay healthy, stay well, take care. Oh.